Hi everyone, I am Dr. Kelly, and today I'm going to talk about how to prevent getting toenail fungus and athlete's foot. Sandal season is upon us, and unfortunately these conditions can really prevent us from going barefoot in summer season and show off our toes. So when we're looking at these conditions, we're actually looking at the same organism, same fungus, except one is infecting the toenail, and the other one is infecting the skin on the bottom of the feet. What I am going to outline for you today, it's really pretty much it applies for both conditions, maybe with a slight variation. So the first thing that I think is really important for everybody to understand is exposure. Exposure can come in a form of a gym, a locker room in a gym, a shower in a public situation, again like a locker room, a swimming pool, hotel showers. Any of those areas can be a great ground for fungal infection because there's a lot of traffic. People come and go, and you don't know who the person prior to you that was in that area, what kind of an issue they had. So if you walk on those surfaces, you can actually catch fungus, and it's important for you to protect yourself. And one way you can protect yourself is to wear slippers or shower shoes. Another place of exposure is your own home. Your own shower floor can be a great place for exposure. And this could come from a family member, maybe a spouse or sibling or parents or children who have had fungus, and you didn't know they had it, and you guys are using the same shower. And that could be also a way for you to catch fungus. So again, it's important to really eliminate that. So with hotels and public areas, you can wear slippers. You could do the same thing at home. However, not that many people want to wear slipper or shower shoes in their own shower. So what you could do is you could actually spray your shower floor with, clean it with very dilute bleach or distilled vinegar. Either one could work really well. You basically get a spray bottle. You put a little bit of a vinegar or bleach, one or the other, and then fill it with water. And when the person is done with their shower, they just do a few sprays on the shower floor, so the next person who uses it will be protected. Another place that the person can get fungus is from a nail salon. And this is something that it usually applies to my female patients, because my male patients are not really that much into getting pedicures. So this is again mainly for you ladies who get your pedicures and manicures. So pay attention to your services and your surroundings. If the area that if the chair has a churning water, most likely there is a filter there. And if the filter is not being cleaned in that basin, in that water, what happens is that you are being exposed to the previous client's germs. So you need to ask those questions. Are these filters being cleaned? There needs to be a cleaning log right next to the chair to show that they're being cleaned properly. And don't be afraid of asking those questions, because after all, it is your health, and you're paying for it. So make sure that this is done properly. So so the basin where your feet are getting soaked, that is one place that you can get fungus. And the other area is the pumice stone and files that they use. If those files are not being cleaned properly using an autoclave machine, or if they're not disposable, you don't know if prior to you, Mrs. Jane Doe had fungus or not, and if the same instrument or implement is being used on you, it's very easily that fungus is being transferred to your skin, and so you have to be very aware and careful. So ask questions: are these instruments being cleaned? And then make sure when you ask that they're being cleaned, they're not just saying yes. You can actually see what they're doing. So that's as far as the athlete's foot goes. So the exposure from the public, exposure from your home, exposure through services. And also what I have seen in my patient population, patients that they have diabetes, that they're not well controlled diabetic patients, they seem to have propensity for athlete's foot, and that's something that I see. And most often they say, well, this is just dry skin, but in fact it's not just dry skin. It is a fungal infection that has been going on for so long that the person doesn't necessarily itch anymore. Your body has put this whole issue on its back burner and doesn't necessarily react to it, but nevertheless it is fungus. So sometimes that is the first step as far as the infection goes, meaning that the person does not have any toenail fungus, but they have athlete's foot, and slowly that athlete's foot will start to go into toenails, and the toenails will start to look slightly thicker and yellow, and eventually maybe all 10 toes become involved and become infected. So athlete's foot can lead to toenail fungus. We also have the reverse. The reverse is the person has toenail fungus, and that fungus stays under the nail, in the nail bed, and it starts to just get proliferate and get bigger and worse. And eventually it will spill into the skin, and the skin will start to become itchy and peeling around the toes, and eventually can go to the rest of the foot, on the bottom of the foot. Now, with the toenail fungus, there are different ways of getting it. One would be these are the it's almost stories, or rather complaints, that I hear from my patients. Is they're almost identical histories that I get from patients. They say, I had trauma to my toenail. I dropped a can of food on my toe. I stubbed my toe. My nail got injured, or I am a runner and I did a marathon and I got blood blister under my nail and my nail fell off. And then what happens is that the nail falls off, it starts to grow, and very gradually it becomes yellow and thick. And most often people think, well, this is just an injured nail and there's not a whole lot I can do for it. But in fact, it's an injured nail that is trying to grow back, but it also has fungal infection. When you do have nail injury, it is paramount that you do not intentionally expose your nails to fungus. And one of those, again, would be going and getting a pedicure in a nail salon that they don't clean their instruments. And if the instruments have fungus on them and they're cutting and cleaning and filing your nails, they're actually inoculating your toenails. Or sharing clippers with family members that they have fungus. If they have fungus, you definitely don't want to use their clippers. Or again, walking barefoot in a public shower. All of that fungus can go into the toenails, and little by little, these nails can get really thick and uncomfortable and unsightly. So to just summarize everything, it's really, again, important to eliminate the exposure when it comes to both athlete's foot and toenail fungus. It's important to not to walk in public showers. It's important for you to wear shower shoes or slippers. If it is in your own house, make sure that you spray your shower floor periodically if you have a family member who has fungus, or if it's you who's getting the treatment. Again, you don't want to expose yourself to your own fungus, so periodically clean your shower floor. Make sure your clippers, your toenail clippers are being either they're washed with soap and water, and then they're either bleached, or you use distilled vinegar to clean them. Alcohol and hydrogen peroxide really doesn't kill fungus, so you need to be aware of that. And this is something that I tell all my patients. Please don't use the same clipper you use on your toenails on your fingernails, because if you have fungus on your toenails, you can actually transfer it to your fingernails. Now, it's not very common to get fingernail fungus, just because our fingernails have a tendency to grow much faster than our toenails, and they're not in shoes all day long. However, you don't want to unnecessarily expose your fingernails to toenail fungus. So have two sets of clippers, and I think family members should have their own set of clippers. Just like you don't share your toothbrushes or your brushes, don't share your own your clippers either. Avoid nail salons that they are really not clean. Again, ask questions about their cleaning log, how they clean it. UV light sometimes is not enough to kill the spores on the implements. You have to make sure that this is done properly using autoclave machine. And also avoid nail salons that they use chairs that has a lot of jets. Again, if the filters are not coming out and being cleaned properly, then you are at risk of getting infection. And with patients that they are they have a tendency to do too much carbs, because maybe they're very athletic and they need that carbohydrate load for energy. Be careful, because too much carb is basically food for fungus, and they will really like that. One last thing that I want to mention is it's the skin on the bottom of your feet has a lot of sweat glands. So most of us sweat quite a bit in our shoes and socks. So treat your feet like you would treat your armpits. You can actually use an antiperspirant, any brand that you like, but as long as it's antiperspirant, spray your feet with antiperspirant. That helps to keep your feet very dry and kind of prevent fungal infection. That would be something that you want to do on daily basis if you're wearing closed-toe shoes 9 hours a day. So with that being said, I hope that you find this YouTube video helpful, and until next time, thank you for watching.